It's Monday, November 21st, 2022. I'm Jonathan Lau, and this is 5 Minutes of Proof, a weekly analysis of the science behind ozone therapy. Today, we're going to take a look at an article entitled The World Federation of Ozone Therapy's Review on Evidence-Based Ozone Therapy. This is actually more of a document, and it was produced in 2015. And I want to thank the World Federation of Ozone Therapy, who put a lot of time and effort into gathering all of this information and putting it together in a very scientific way. We're going to just briefly touch on the beginning part of this, and we'll go through it systematically over the course of the next few weeks and take a look at different parts of it that I think will be helpful in veterinary medicine, even though this is really geared towards human medicine. So with that said, let's go ahead and take a look. Now, as we look at the table of contents here, you'll see page 50 starts references. References run all the way through page 117. That means we have 67 pages worth of references. And that's incredible. There's a lot of research, and this was in 2015. As we well know, a lot of research has been done over the course of the last few years. So this does not take that into account. However, there was still a good body of evidence available at that time. So they go through a lot of very practical things: medical ozone generation, ozonated water and oil, medical ozone pharmacology and toxicity, ozone ways of administration. Then they talk about what they view as 3 systemic modalities or administration methods: major, minor, and rectal. So there's a lot of really interesting information in here. I want to dive into it. I also want to thank Professor Jose Nossi, who put a lot of work into this, along with the staff there, the board, the researchers, who you can see here. Who did a lot of work on this. Really appreciate it. So there's a few things in the introduction that I wanted to focus on. They say this: we recognize that a puzzling skepticism still persists among many academic and official authorities, mainly due to prejudices and to the lack of more abundant pharmacological and controlled clinical studies. In our opinion, these facts do not justify the strong opposition to ozone therapy, but on the contrary, should encourage the health authorities to keep organizing such studies, taking into account that this therapy is not supported by the pharmaceutical industry and that it can contribute to improve the population health condition at much lower costs than other treatments. But of course, pharmaceutical industry, and rightly so in many respects, isn't interested in treatments that are outside of its purview, outside of what is going to make that industry money and that company money. So we have to take that into account, though, and realize this is something different. They go on to say, it is true that differently from any marketed drug, acting with a precise and statistically defined mechanism following the mass action law, ozone acts as a prodrug, activating a myriad of subcellular events, many of them already elucidated in a significant part. That's true. So we have a lot of information about how ozone therapy works. However, there's still a lot to go. There's still a lot to learn because there's so many different pieces to this puzzle. These actions are not easily associated to a particular clinical activity and thus are very difficult to assay. Because of this, we do not have yet a precise methodological approach to evaluate this and standardize the clinical efficacy of ozone therapy. Nevertheless, once again, we strongly think that this fact alone could not represent a valid reason to block any progress in the aim to look a little more beyond our current knowledge. So I like that statement. I like all that was said there because I think it really sums up what we're wrestling with and what we're fighting against here, at least in part with ozone therapy. Now, again, the financial side of it is a huge part of it, as you have pharmaceutical companies that have lobbyists and put a lot of money and effort and time into marketing and into persuading people in power that these things need to be on the market. A couple other quick statements. Ozone, like other agents and unlike the common drugs that act on a specific receptor, induces a small and controlled stress to the whole cell when used at adequate doses. This in turn triggers a series of intracellular metabolic processes and promotes a myriad of activities stimulating many cellular mechanisms. Because of these reactions, the defense mechanisms of the cell are alerted and improve functionality, explaining in part the surprising therapeutic actions of the gas. You might ask, what mechanisms, what processes? We're going to get to that, okay? So that's in here. Finally, we hope that this document, so this is the purpose of the document, which is primarily intended for health practitioners using ozone who want to refine their techniques and learn about the scientific bases that support the clinical use of this therapy, would be also useful to the health authorities as guidelines and summary of the more recent research published worldwide. Well, that's all we have time for today. This has been 5 Minutes of Proof. We'll see you next week.